Your doctor probably told you that supplements are a waste of money. And honestly, they are not entirely wrong, but they are not entirely right either. Because the real story is not that simple. Some supplements are genuinely overhyped garbage. Others have some of the strongest clinical trial data in modern medicine. The problem is, most doctors lump them all together, and that blanket dismissal is costing people real health benefits. Today, we are going through 5 supplements that doctors routinely dismiss, and we are looking at what the actual peer-reviewed research says. No cherry picking, no supplement industry spin, just the studies. Multivitamins are the poster child of supplements are a scam. And to be fair, the mortality data is not impressive. Multiple large studies have found no significant reduction in all-cause mortality from taking a daily multi. But here is where it gets interesting. In 2022, the Cosmos Mind trial, a large randomized placebo-controlled study with over 2,000 participants, found that daily multivitamin use was associated with a statistically significant slowing of cognitive aging. We are talking about roughly 60% less cognitive decline over 3 years compared to placebo. Does that mean everyone needs a multivitamin? No. If your diet is already rich in vegetables, whole grains, and diverse protein sources, a multi is probably redundant. But if your diet has gaps, and most Americans do have gaps, a basic multivitamin can provide genuine insurance. The verdict here is highly individual and depends almost entirely on diet quality. Fish oil might be the most misunderstood supplement in the entire category. You have probably seen the headlines, "Fish oil doesn't prevent heart disease," and "Fish oil linked to cognitive decline." Those headlines are misleading at best and outright wrong at worst. Let's start with the VITAL trial. This was one of the largest and most rigorous cardiovascular supplement trials ever conducted. Over 25,000 participants, randomized, double-blind, placebo-controlled, running for an average of more than 5 years. The results showed a 28% reduction in heart attack risk in the fish oil group. That is not a small number. The bad for your brain headline, that came from one subgroup analysis in a different study in people who already had low omega-3 status and were taking a specific formulation. It was not the main outcome. It was a cherry-picked finding that got amplified by clickbait journalism. What actually matters with fish oil is your omega-3 index, the percentage of EPA and DHA in your red blood cells. If it is below 4%, you are in elevated cardiovascular risk territory. Most Americans are between 4 and 6%. The target is 8% or higher. Fish oil is a legitimate, evidence-backed tool to get there. This one has a complicated history. Linus Pauling, 2-time Nobel Prize winner, spent decades claiming that megadoses of vitamin C could prevent and cure the common cold. He was wrong about that. Large meta-analyses have consistently shown that high-dose vitamin C does not significantly prevent colds in the general population. But here's the nuance. Moderate vitamin C supplementation, around 200 to 500 milligrams per day, does support immune function. The Cochrane review found a modest but real reduction in cold duration in people who supplement regularly. It also plays a critical role in collagen synthesis, iron absorption, and acts as a potent antioxidant. Where people go wrong is the megadosing, 5,000 milligrams, 10,000 milligrams. At those levels, your kidneys just excrete the excess, literally expensive urine. There is no evidence of therapeutic benefit beyond roughly 500 milligrams per day for most people, and high doses can actually increase kidney stone risk in susceptible individuals. Moderate vitamin C, reasonable. Megadosing, not justified by the evidence. Glucosamine is one of the most popular joint supplements on the market, and doctors routinely dismiss it. Some of that dismissal is deserved. The marketing has gotten way ahead of the science. But when you look at the actual meta-analyses, the picture is more nuanced. A 2010 meta-analysis published in the British Medical Journal Analyzing data from over 3,800 patients found that glucosamine did produce statistically significant reductions in joint pain and improvement in function for osteoarthritis, particularly hip and knee. The effect size was modest, but it was real. The key details. Glucosamine works best when combined with chondroitin. It takes weeks to months to show benefit, so short trials give false negatives. And it appears to work better for moderate to severe osteoarthritis than mild cases. Is it overhyped? Yes. Is it completely useless? The evidence says no. For someone with genuine osteoarthritis who has tried it properly, correct dose, right combination, sufficient time, there is real clinical support for modest benefit. Conjugated linoleic acid, or CLA, is where I have to be the most skeptical. CLA is marketed heavily for fat loss and body composition, and the claims can get pretty dramatic. The actual clinical data tells a sobering story. The most thorough meta-analysis on CLA and fat loss, published in the American Journal of Clinical Nutrition, found an average fat loss of about 0.1 pounds per week compared to placebo. Not 0.1 pounds per day, per week. Over 6 to 12-week studies, you're looking at maybe half a pound to a pound of additional fat loss total. That is not nothing, but it is nowhere near what the marketing suggests. And at the doses required to see even that modest effect, typically 3 to 4 grams per day, you are spending real money for real minimal results. There are also some concerns from rodent studies about potential negative effects on insulin sensitivity at high doses, though human data is less clear. CLA is genuinely overhyped. This is one where the doctors dismissing it are largely correct. So here's the big picture. Some supplements, like CLA, are legitimately overhyped. Doctors are right to be skeptical. But the response to overhyping should be careful evaluation, not blanket dismissal. Fish oil has 25,000-person trial data showing 28% heart attack risk reduction. That is not a weak signal. Multivitamins have a large randomized trial showing cognitive protection. Glucosamine has meta-analysis support for osteoarthritis. These are not fringe findings. The problem in medicine is that supplement research gets held to a lower standard by the industry and then overcorrected against by mainstream medicine. Neither extreme is useful. Here's what separates a supplement that helps from one that does not. Quality matters. Because the supplement industry is not tightly regulated, third-party testing from organizations like USP or NSF makes a real difference. Dosage matters. You cannot take a fraction of the studied dose and expect the studied outcome. Bioavailability matters. Some forms of a nutrient absorb dramatically better than others. And personal need matters. A supplement fixing a deficiency you do not have is unlikely to help. If you want more evidence-based breakdowns of what the science actually says about supplements, without the industry spin and without the reflexive dismissal, subscribe. We do this kind of analysis regularly, and the goal is always the same: give you the tools to make genuinely informed decisions about your health.